It's easier to do your best when you feel like you look your best. It's empowering to look in that mirror and like what you see there. And here to help us look as good as we can for as long as we can is board-certified plastic surgeon Dr. Christopher Hamwi and physician's assistant Sia Geiger. Thank you guys so much. You are from Florida Plastic Surgery and Med Spa.
Yes.
We're so happy to have you here this morning.
Yeah,
wow,
thank
you so much for having us.
Well, I'm glad to see you.
How apropos.
Yes, because Linda says she does not consider herself old, and we don't consider her old either.
But it depends a lot on these people. We hear a lot about new procedures, Dr. Hamwi. What is something that's new out there, and how do I know which one to choose?
Yeah, well, that's a great question. And I'll tell you, when it comes to plastic surgery, and oftentimes med spa services as well, there's a wide variety of treatments that range from non-invasive things to more invasive surgical things. And typically as procedures become more invasive, they become more powerful. But there are a lot of things out there that can help people, like you were saying, look their best and feel really great about themselves that may not be surgery. And so things like Botox and fillers are particularly popular. There's some new devices that use energy in order to stimulate collagen and tighten skin that are available. And then for really powerful, dramatic results, surgery is still kind of the gold standard.
So, Sia, what are some of those non-invasive things that we can go right back to work or don't have any downtime
Yes,
from?
lunchtime treatments,
Yes.
right?
Of course, Botox and I are good friends, so you can tell us about
Botox is
that one.
definitely probably the most common procedure that we do in the office. And this is a medication that it's injected into the muscles of the face, and it causes a temporary relaxation of those muscles. So it helps prevent wrinkles from forming and also treats any active wrinkles that can happen when you're making certain facial expressions.
So what about the fillers?
Filler, yes, it's a naturally occurring substance that we inject into the skin, and a lot of times we're treating volume deficits. So as we age, things kind of start to shift down and we'll look more tired, so it helps people feel more refreshed and creates some really beautiful contours. You can see in the photo on the screen.
Oh, yes.
She already had beautiful cheekbones, beautiful lips, but we just wanted to enhance that and help with like the shadows of her face.
And things like laser and things like that, the energy type
Yeah,
procedures.
the energy devices as well. We have the Morpheus 8 in the office. It is a microneedling and radio frequency device that causes contraction in the skin. It's really good for people who want a little bit of a lift, where a little bit will go a long way, minimal downtime, and it helps increase collagen production, which is usually the #1 cause of why we're seeing things start to shift and age and wrinkle formation. So,
but if we need more than that,
yes, that's where he comes into play.
Plastic surgery.
Right. So surgery is still, like I said, kind of the gold standard for really significant changes. And when we're talking specifically about the face, what people tend to find as they age and things start to relax and as volume starts to decrease, the volume in the cheek starts to come down and we'll see some nasolabial folds. Jaw lines can start to develop jowls, and then the skin in the neck can start to come away and start to look loose or wrinkled. And so when you do these procedures such as facelifts or neck lifts, you can really help resuspend that tissue that's sort of started to fall and create some really nice jaw lines, some really nice angles in the neck, and really kind of reverse the significant signs of aging in a really powerful way. So these are things that I love to do, and you know what we typically tell people is if you've ever stood in the mirror and kind of pulled back like this, then it's probably time to
talk about surgery.
To talk about
What
lift.
about twilight anesthesia now?
Yeah.
Is it going to hurt? That's my question.
Right. So no, twilight is a great option for these surgical procedures. They're not quite as strong as general anesthesia, but they can still put people out in a way they don't feel, hear anything. But it's similar to getting a colonoscopy. So it's maybe not as intense of an anesthetic, but it still gets the same result.
Is age a factor?
Well, it can be. You know, some of the things that Sia was describing in terms of the Botox, the fillers, the energy devices, can be for people who may be a little bit younger on the spectrum, whereas as we get older, the surgery things tend to perhaps be a more appropriate intervention.
We need your guidance in that.
Yeah.
Okay, what do the patients tell you when they come back after they've had this procedure?
Right. Well, I'll tell you, facelift patients, neck lift patients, they talk about having a new sense of confidence and really being able to sort of approach the world feeling excited about things. So,
Yeah.
It's,
I bet you hear the
it's
same.
fun. It's exciting.
Oh, yes,
Yeah.
it is.
Yeah.
And it'll make you wait until you're 88. You know? You can learn more at an upcoming facial rejuvenation seminar on May 9th from 5:30 to 7. You do have to RSVP. It's required. For details and more information, go to floridaplasticsurgery.com.